Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
This is Dr. Candace Pierce, and you are listening to our Elite Learning podcast, where we share the most up-to-date education. Welcome back to our second episode of our series on how personality traits and personal styles can guide nurses in finding their ideal specialty. In the first episode, we explored the core personality traits that play a significant role in our profession. And in this episode, we're going to take that knowledge a step further by trying to match some of these traits to specific nursing specialties. So whether you are detail-oriented, empathetic, or thrive in high-pressure situations, we know that there's definitely a path that's just right for you. Dr. Erica Ramey is going to be continuing this discussion with me. Thank you for hanging out with me for episode 2.
Happy to be here. I love this topic.
It's definitely a fun topic. And I do want to, again, preface this episode like we did in episode 1, that while we are going to be discussing how different environments and roles can really complement your natural tendencies and strengths and probably will help you to find a specialty where you can excel and find satisfaction, I really do think it's important to reiterate that while some traits may naturally align with certain specialties, nursing is versatile and it's a dynamic field, and you will have a unique combination of skills and traits that are really going to let you be successful in any area you choose. All right, so to kick us off and get us started, what personality traits really tend to fit well for nurses who are looking more towards like critical care, emergency, more of those fast-paced trauma settings?
Absolutely. So individuals who really like fast-paced, stressful, I'll go ahead and call it what it is, a little bit more stressful. So people who might consider themselves to be adrenaline junkies, who like being challenged, who like thinking on their feet and making quick decisions, who really kind of enjoy not having a lot of time to sit down because you're kind of go, go, go. It does certainly make the shift go by faster. Places like the emergency room or critical care or trauma would probably be more appealing for those individuals because you do stay busy. It is high stress. You're thinking on your feet. You're moving quickly. Many people really thrive in that environment. So that might be the area for you if those qualities sound like you. And I will say, as you've mentioned at the start of this episode, anyone can work in any area, but if you're in an area like this and maybe that isn't your natural disposition, you might notice that you're feeling a little bit more burnout, or on your off days, you might feel a little more of a tendency to kind of check out a little bit. And that might be a sign that maybe the area you're in isn't the best natural fit, because it's taxing you a little bit more than you have to give. Whereas someone who maybe thrives in this area might enjoy that and then still have energy on their off days to kind of enjoy and engage in their life outside of work.
Absolutely. And I will say, I do see some differences between critical care and your emergency trauma. Since my background is in critical care, I find that I'm more detail oriented than my emergency room trauma friends,
Yes.
I'm going to be, and I like to look at everything. I like to look at the whole picture, and they're more like, no, I just want to figure out what their problem is and then send them up to you.
Right.
So I definitely see some different personality traits between these two. Do you want to kind of touch on those?
Oh, goodness. Isn't that sort of just a running joke at this point? The report, giving report between, like, say, the ER and the ICU. And, what's important to that ER nurse that they're communicating is oftentimes not at all what the ICU nurse is actually wanting to hear or what's important to the ICU nurse. And part of that is just the acuity and the nature of the unit with which they're working. So sometimes in the ER, the priority really will just be stabilize, right? Just put the fire out or stop the crisis. And then thinking beyond that that they're going to leave to the floor nurses, right? They're going to leave it to the ICU nurse.
Right.
Like, okay, no, we saved their life.
Yes.
Your job is to continue that process.
Right.
You could figure out what's wrong from there. And that may be similar to, a paramedic in the field too. The priorities are just a little bit different because of the role that they serve. And that's okay. We need both. We need them to be stabilized in the ER. And then when they get to your unit, then you're detail oriented. We can start looking at what's going on here, what's the underlying issue. But we can't do any of that if they didn't successfully make it out of the ER. So we need both. We need both personality types. But to your point, each unit might be a better fit for a different personality type. And if you're not especially detail oriented, then maybe it makes sense to be in a place where you can really hone an impressive, quick thinking skill set, stabilize, and then you're going to the next crisis, but you're making sure that patient gets taken care of by someone who is going to be a little more detail oriented. So,
and you said next crisis. And so a lot of times too, what I have seen is it's, in the ICU, you're going to have your patient for a little longer typically, because if they're really that sick, you're going to be caring for them. It could be, 3 days to 3 months or longer, so to say. And so you're going to be seeing that. You're going to be, I don't want to say growing with that patient, but you're going to be going through whatever it is that patient is going through along with their family for a longer period of time. Whereas in the emergency room, you never know, like you could see something different every hour or, every couple of hours, but you're always going to, and when you come into work, typically you're not going to have the same patient. So you don't really get to bond with them like you would in the critical care.
Absolutely. I would say, hopefully you won't see the same patient in the ER. An exception might be if there's a bed shortage or something, and maybe sometimes patients get held a little bit longer. But that's not the function of the ER, right? It's supposed to be crisis stabilization and then on to the appropriate unit. Whereas, yes, in many and most other areas, we do expect to see our patient probably on our next shift and when we come back in. So you're building that relationship there. Bonding a lot of times with your patients as well. Whereas sometimes in the ER, we may never see that patient again, unless they have an issue that, continues to bring them back in and a shortage of primary care providers. So we serve different functions on different units. And that's part of why we're having this conversation. Those different units are better suited for some different personalities oftentimes.
So where does compassion and empathy fit in between your critical cares and your trauma-based units?
That's a good question. So in critical care, you naturally have a little bit more opportunity for compassion. And I'm calling it opportunity because, a nurse in both units can be just as compassionate. Right. But in critical care and in any longer term type care, you have more opportunity to display that compassion. But in an emergency setting, sometimes compassion, while present, may not be as obvious because of the nature of the work that they're doing. But you can have empathy and compassion by doing things in an emergency setting, like maintaining privacy and the dignity of the patient. That is compassionate care, and that's certainly empathy. Keeping your patient safe, especially if there's a domestic violence type issue in the emergency setting, kind of thinking on your feet, considering the social determinants of health that may be impacting why they're there, not being judgmental. Not saying things that are judgmental about why that patient is in the emergency room or what happened. It may be true and we may be thinking it, but it's not necessarily helpful or certainly maybe not compassionate. So even in a crisis, we can be compassionate even when we're providing fast-paced care in a stressful situation. It just is going to look a little different, right? But maintaining our patient's dignity in a crisis is compassion, and it is compassionate. So it just looks a little different. Both units support both, and there's opportunities for both. It's just how it's expressed might be a little bit different.
Absolutely. That's good. I like that. So looking at personality traits specific for, say, pediatrics, geriatrics, OBGYN.
Yes. So pediatrics, we're working with kids, and that's what everybody thinks at first, but you're also working with families.
Yes.
So it is wonderful if you're working in pediatrics to be someone who relates well with children, obviously. So we're not forgetting these are brilliant, competent, critical thinking nurses, but they're still able to kind of get on the level of a younger child or an adolescent and sort of connect and be warmer and more approachable, but then also balance the needs of the family, which are oftentimes more complicated and more demanding than the needs of the patient, of the child.
Yes.
So you're a little bit sometimes of a mediator, especially if it's a teen or an adolescent, or if there's some complex family dynamics. So playfulness, certainly being able to relate to younger patients and be comforting, but then also there's a nuanced family dynamic skill set that's especially beneficial in pediatrics as well, I would say. In the OBGYN setting, certainly empathetic and supportive nurses are very beneficial. I would even say nurses who are skilled listeners and good at expressing support in a way that the patient feels heard and validated. Sometimes in mental health, women's health, apologies, that's my habit, I'm mental health. Sometimes in women's health, especially, there's a little bit of a tendency to minimize or maybe overlook or not fully hear out our female patients. So if you are working in women's health, just letting the patient feel like you hear them and you believe them and that you are listening and you're going to communicate that can go a very long way in building rapport and getting them to buy into their treatment plan.
Agreed.
And of course, you do need some crisis management skills in the OBGYN setting as well, because hopefully everything goes well, but in many cases things can go wrong and it can happen very quickly. And then we've got 2 lives on the line or more. So being able to stay calm in a crisis is also very helpful in that setting as well.
Yes. I actually tried to start out in pediatrics. I thought I wanted to go to the NICU. And I found that I loved the kids. I worked at a children's hospital for like a semester, and I loved the kids. But what I found difficult, which made me go to adult health over pediatrics, was I had a lot of trouble hurting them.
Oh, that didn't go where I thought it was going to go. I thought you were going to say I loved the kids, but the parents.
Well,
but no, that's a good point. Yes.
Yeah, I really struggled because they trusted me and I wanted, and I got to play with them, but to come in and have to start an IV on them, or I had to participate in a spinal tap one time, and I remember that, and just I actually passed out in the middle of that. They were making the baby cry,
No.
and I would just I really struggled personally with the relationship that I wanted to have with them as a nurse, but also being the person who had to hurt them in order for them to get better. Yes.
Yeah.
So I didn't line up well with pediatrics.
That's a very good point there. I'm thinking about, taking my infant for her shots. And I love her arguably more than anyone, except maybe her dad. We might be tied. But knowing I love her, and because I love her, I'm taking her and she's going to get these shots and it's going to be awful and she's going to cry. And only having to do that every couple months or so. So thinking about being the nurse in there administering them and making babies cry all day, it wouldn't be for me. But I would think maybe on the receiving end of that, being the one that's also coming in and building those relationships and helping them get better.
Yes.
We all know nurses can be really life-changing. And many people who go into nursing do so because as a child, they needed medical attention and they had a great nurse, and that's, we see that a lot. So clearly there's a strong impact there. But I would say if you're in pediatrics, it's because you love what you do if you stay there, certainly. So that's a good point, though. I didn't think that's what you were going to say.
No, I mean, in that short time that I worked in pediatrics, I was touched by more of those patients than I ever have in adult, like working with adults. Just,
Sure.
they always, it didn't matter what their situations were. They always had a smile on their face for the most part. It's like they didn't know any other type of life than the life that they had been living in the hospital.
Yeah.
And just their spirit. And I adored them so much. And for me, it just became harder for me to be like, oh, I have to come in here and start your IV, or, I have to draw some blood, or that was really hard for me. So I didn't make it in pediatrics.
Yeah.
My personality did not line up there. So
a lot of my patient population, again, it's mental health, but a lot of the people I see are children or adolescents. In part out of necessity. There weren't many in my area, many providers who saw young people. So I had a larger patient population, but that's different. I'm not giving any shots. I'm not doing IVs. I'm trying to help them through some difficult life challenges. So it's very rewarding in my end, but you make a good point. So it'd be worth, maybe you should do a podcast talking to a pediatric nurse about what that's like and that experience.
Yes. How do you compartmentalize that? Because that was something I could not compartmentalize well. But preferred personality styles that are going to align with educators and leadership and maybe informatics. Where do you see those personalities align?
So for informatics, I would say, please, please, please be good with technology.
Yes. Enjoy technology.
Yes. And like it. Yes. And, be good at maybe synthesizing information, organized and detail oriented is great. You don't necessarily have to have the same tolerance for socializing and for other people. So informatics can work well. So
introverts are good there.
Yes. Informatics can work very well for introverts, as can research and other areas of nursing that allow you to work a little more independently more often. Nurse educators is my favorite because that's, of course, my main job, as we know. Yes. And for nurse educators, I think it's important that you, regardless of your personality, I think it's important that you're bringing in some experience and a strong skill set. And then our students, of course, benefit when we are excellent educators and when we're organized. So when they log into the course and they can find things and, and that we know what we're talking about and we admit when we don't know something. So being personable is very helpful. I think you can be an excellent nurse educator, whether you're introverted or extroverted, as long as you're a good communicator, I will say. Right?
Yes. Yeah,
so
I
you
agree.
can be, I'm what I like to call an outgoing introvert.
I'm
so
an
at the
introvert.
end of the day, you get it, right? So you can be a great educator and be quite introverted. You just have to kind of strike that balance. Maybe you schedule your time that you plan to be extroverted, and then you don't do anything else the rest of the day.
Because when you're done, when I'm done with clinic, when I was done with, 3 hours of lecture, when I have my office hours, when I'm in the hospital, by the time that is all over, being introverted, I am exhausted. But
Absolutely.
my students never knew that I was an introvert until we would talk about personalities and things. And I'd be like, no, I'm an introvert. And they're like, what? You're an introvert?
No, you're not. Yeah.
I'm playing that extroverted card very well because you have to play that in order to be a good educator, to connect with your students. That really opens the door, makes them feel more welcomed, makes them feel like you're approachable. But it's exhausting when your natural tendency is to be an introvert.
It is.
Oh my goodness.
You are so right. And it's important to kind of get that the passion for the subject matter across too.
Yeah.
And in my area, teaching psych, especially to when I was teaching at the undergraduate level, not everybody likes psych or understands it or realizes you work in psych no matter where you work. But trying to make sure that, it's true. Making sure my students left the class with an appreciation for and a fondness of psych, even if they had no interest in working in psych themselves. So in order to do that, I've got to make sure I'm really giving a positive impression of psychiatry and making sure my passion for it is coming across. So you're right. It's a little bit of, I would say this for those considering faculty roles, it's a little bit of performing when you're teaching and you're sort of on stage. So it is helpful, I think, if you like talking and communicating, and if you like teaching. It sounds so basic, but if you really are someone who likes to precept, you like to teach and show others in the clinical setting, if you're the one signing up to be a clinical mentor, then teaching might be sort of a natural fit for you. So if that's already something you enjoy, that's a direction, an area of nursing where we need you, and I would encourage you to consider.
Absolutely. And I would say that when I was a young nurse, I said I would never teach.
They all do.
Yes. I did. I was like, that is not anything I'm ever interested in. But somehow I learned that I loved it. I was actually going to go be a nurse practitioner. I was like, no, I'm just going to go do this. And somewhere along the way, I found a joy from teaching and ended up, finishing my doctorate in leadership administration and teaching.
Yeah. Never say never, right? My students will even say that now. I'm never going back to get my nurse practitioner. I'm never going like, well, all right, I wasn't either. And here we are.
Right. You don't know, they say you don't know what you don't know until you learn what you don't know. And it was when I was put into the roles of what it was where I had to be a teacher that I learned then that I love it. So, even if you're over here in med surg and you want to try something different, try it. That's my advice.
Absolutely. That is good advice. And, I think know yourself, as we've stressed. And if you're not sure what area of nursing you belong in, you can get feedback from people who've worked with you or who know you well, to kind of, tell you, well, what I see is you seem to do well in this area, and pay attention to that. Because sometimes we don't know ourselves as well as we would like to, especially maybe more junior nurses who are just kind of starting out, or who are just younger in general. You may not know yet, where do I fit here? What is my personality? Where am I going to thrive? But never say never to being a nurse educator. Yes,
for sure.
Sometimes you arrive there quite by accident.
And I will say, for those who are really just starting out in our profession, talk to your professors. Because over the 3 to 4 years that you have been with them, they have gotten to know you. And they also, for the most part, most of them, I can't speak for all of them, but all the ones that I have worked with really know the profession well and know what is needed to thrive there. And so I really do. If you're kind of struggling with who am I in this profession and where should I go, they can usually give you some really good advice.
That's a good tip there. That's gold.
Yeah, for sure.
You're doing great.
Oh, thanks. Okay, so going back to personalities and how well they, did we touch on nurse manager? I know we talked about nurse educator and informatics.
We didn't touch on nurse manager, and let's do that. I think one of the mistakes we make in nursing that, we do see sometimes in the business world, but maybe not quite as often. Sometimes we have a tendency to promote people because they've been there the longest, or because they're willing to, and not necessarily because they're a good fit for leadership. So sometimes an amazing, phenomenal nurse is not going to be an amazing, phenomenal nurse manager or nurse leader. So the skills don't always translate if that individual doesn't have strong leadership skills.
You're right.
And the ability to develop trust with the people that are, their direct reports and that are working under them. So to be an excellent leader, of course, you want to be well organized. I would argue you really need strong ethics, both personal and professional ethics, because your team is watching you and following suit in many cases, or you kind of set the tone and the bar for what is professionalism and what is ethical in this setting. And then that will determine if your team trusts you or not. And if you don't have the trust of your team, you're going to have a hard time leading your team. So really that I really want to kind of emphasize that. And that's personal and professional ethics. And some of that comes in the form of boundaries, and some of it comes in the form of transparency. So there's room for both, and there's, depending on the setting and the people, there isn't a hard and fast rule there. It's going to have some variability. But being organized, being an excellent communicator with strong emotional intelligence, having enough experience to know what you know and what you don't know is very important. Some of that can be overcome. Some of it can be learned on the job. But again, you want your team to respect you and to know that they know what you're doing. So some time in the trenches there is helpful, especially.
I loved what you said about transparency too. And I think that is so important because you need to be who you are forward facing when your back is facing the opposite direction. They need to know that what you were saying in front of them is what you were saying behind them.
Right. And about them and to them. Yes.
And that's such an important, because when you lose that, you're not necessarily going to get that back.
Right. And then it's going to be hard for you to be an effective leader, and your team will suffer for that. And in nursing and healthcare, then our patients will suffer for that.
Right. And that goes back to ethics, their personal and professional ethics. So yes, very good. All right. Personality is meshing well when you have autonomy and you have a pace of specialties like aesthetics and travel nursing, where you're kind of more on your own.
Yeah. So that I think that area grew in popularity, especially during the pandemic. A lot of people were venturing into travel nursing that maybe had not thought about it before. And I think it's a good fit for people who are pretty comfortable with the unknown. So being able to tolerate a certain amount of unknown. So, you're looking at a travel assignment. Are you comfortable kind of moving from one location to another? Are you comfortable with short-term contracts? It's almost in some ways like sort of managing your own business. Is it a case where you need to have your own liability insurance? Do you need to be on top of your licensure? Or are you going to be working with a company that helps do that for you? Are you okay spending a lot of time in a hotel or somewhere kind of alone? So travel nursing tends to be a better fit for people who are pretty independent. They like to see new places. They are comfortable eating alone, traveling alone, being gone for this amount of time. You don't mind staying in hotels or apartments unfamiliar to you. It is a lot more difficult. I have seen it be a lot more difficult for some nurses who are also balancing families or small children if you're traveling for an extended period of time. So shorter jobs closer to home, that may be a good fit. But, a 12-week stint across the country may not be such a good fit. So that is really better suited for independent folks who don't mind a degree of uncertainty, for sure.
Yeah, they can handle the stress of the unknown.
Yes, because you're walking into a new unit where you don't know where the supplies are and you don't know any of the people that you're working with. They may love you and appreciate you, or they may not want you there because they didn't get a raise because that facility is hiring you.
Are you going to be supported or not supported? I don't know at this unit.
You don't know. And if you have a wonderful personality and you really connect with people well, you may fit into different travel nursing positions than if you're a little bit less approachable.
I feel like I need to be a lot more extroverted in order for me to be able to connect and be a travel nurse.
Yeah.
Specialties like psychiatry and mental health, which traits really facilitate those therapeutic patient interactions?
Well, this is my favorite, of course. Bias is very apparent. Many of the things that we've already talked about, certainly empathy, right? There's a lot of stigma in mental health. So being able to empathize with our patients and, we may not have gone through what they're going through, but being able to take a step back and recognize that this is a person and they're here for a reason and life circumstances are different for each of us. And we all at some point need some help for something. And so compassion and empathy are very important in mental health. I would say appropriate professional boundaries are also really important. So sometimes a student or someone I'm mentoring will express an interest in mental health because of some traumatic things that they've experienced. And sometimes that's great and it's a good fit and it will really help them empathize. But for some individuals, their own mental health challenges can make it very difficult to maintain good boundaries and to constantly be hearing things that may be re-traumatizing for them. So sometimes it's really not a good fit for mental health because it's going to cause an exacerbation in their own mental health. So knowing yourself and making sure that you are getting the care that you need is important before entering mental health, not just because of burnout, but because again, if you're on that journey yourself, it can be re-traumatizing for the individual. So it's not a good fit for everyone who loves psychology, shockingly, which surprises some people. But if you have compassion and empathy for people with mental health struggles, and if you have a little bit of a tough skin, because we are meeting people often when they're at their worst, they're not really themselves. They may say things or be experiencing things that change how they're interacting with people around them, especially in the inpatient setting. You know, there is some potential there for some hurt feelings, I would say. So you do need a little bit of a tough skin, in addition to the compassion and empathy there.
Right. I see a lot of self-reflection needed in this particular role. Okay, so our time is getting short, but I really want to hit on some 3 important questions that I kind of want us to close out on. And that would be, how can nurses identify their own strongest personality traits to really help them find that optimal specialty match?
Right, absolutely. We've mentioned a few ways. In addition to those, I would say if you haven't done just some maybe general personality inventories, if you don't really know, really the DISC or the Myers-Briggs or whatever your preference is, if you don't really know if you're introverted or extroverted, I would say talk to your people that know you best, your family, your close friends, and kind of get some feedback on, what do you notice about me? What seem to be some of my strong traits? I liked your point about talking with professors. So if they're still in a nursing program, getting some feedback from professors, like what type of area do you think I might be successful in? Pay attention to your own interest. If you've been in different clinical settings, if something really made you excited, like made you want to come back into work or made you excited on, Monday or whenever the work week rolls around, pay attention to that. There may be some connection there. Have a good finger on your stress tolerance. That may tell you what acuity and what kind of pace might be a better fit for you. And then remember, in nursing, we have so many options. So if you get in an area of nursing that you thought you would love, but you're finding that you're feeling a little bit burnout or it's just not what you thought it would be, you can change. You can try a different area of nursing. You're not stuck there. In fact, it's better for our profession that you transition and find a role that you love than that you leave the profession. So know yourself, get feedback from family, friends, professors, some inventories or self-assessment guides, and then try out different areas of nursing until you find something that's a good fit.
Until you find your home.
That's right.
So
which could change, right? There's seasons for different homes. Yeah, absolutely.
Yes, we move often, so.
Yes. So you get it. Yes.
Yes, I do. Well, move homes often, I should say. So for nursing students, what advice do you have on how early they should be evaluating their personality to kind of try to find where they fit?
Oh, that's a good question. In general, I would say all of us all the time should be kind of getting a self-assessment of where we're at and who we are, because our personalities also can change over time. Right. So if you're already in a nursing program, I would say go ahead and start doing some of that work. And then when you're precepting or when you're doing clinicals in different settings, that's a great time to be kind of testing it out a little bit. what do I like about the culture of this workplace? What do I like about the patient population here? Or what do I not like? What's not a good fit for me? We can oftentimes spot that earlier than what is a good fit, right? You can walk on a unit and say, well, this is not it. This is not a good fit for me. So pay attention to that. Yeah, exactly. It isn't going to be that. I don't want to say anyone because that's not nice, but we all had one probably in nursing school where we thought, well, this area is not for me. For many people, it was psych. I mean, truthfully, whereas I was like, I don't know, this seems okay. But I had some colleagues that were like, not this. There it is,
Mark
right?
that one off real fast. I couldn't.
And that's okay. That's okay. We need nurses in all of the areas. We can't all do the same thing. So pay attention to kind of your internal response in different clinical settings. And if there's an area that interests you or at least didn't disinterest you, then explore that a little bit more while in nursing school. So to answer your question, Candace, I would say immediately is a good time to start.
Absolutely. I definitely agree. Okay, so we've gone from nursing students. Now let's go to those nurses who maybe want to evolve in their careers and are kind of looking for something different. How can understanding their personality help them at least lead them to a productive role transition?
That's a great question. And part of that is recognizing, as we mentioned, we change over time. And our ability to really be successful and enjoy roles changes over time too. And sometimes the physical demands get to a point where we can't manage that anymore. Or sometimes the new technology and the mental demand gets to a point where it's overwhelming and we can't or don't want to manage that anymore. So similarly, we want to be paying attention to our personality types and what areas of nursing might be better suited. But then we also want to look at, well, what are our other skill sets? So what's our current training? Are we interested in more training? Are we interested in more education? Do we want to take what we know to maybe the clinical or the academic setting? And kind of consider our options, see what our strengths are, see what ladders your facility may have. Are there roles you can transition into that your facility supports if you want to stay in the same organization? Is leadership appropriate for you, or is research or QI or a non-bedside role maybe a better fit at that point in time? And oftentimes that can look like teaching, which I love. But seeing what your options are that interest you and kind of what that next step might be is a good place to start.
Such great advice. Thank you so much for sharing.
Yeah,
so that's gonna wrap up our 2-episode series on nursing personality traits and thriving in diverse nursing specialties. And we really hope that you found our discussion on matching personality traits to nursing specialties insightful and empowering. But again, please remember that while understanding your personality can really help guide you toward a fulfilling specialty, our profession is diverse and it's inclusive, and you alone define your success through your dedication, your adaptability, and your passion for patient care. So no matter where you choose to specialize, your unique contributions are what make nursing such a vital and rewarding profession. And Erica, this was such a fun discussion.
It was great. Thank you for having me. I enjoyed it.
Thank you for taking time to join me and to share your knowledge so that we could have this discussion today. To our listeners, thank you for listening. And if you have not already, I encourage you to explore many of the courses that we have available on elitelearning.com that are going to help you grow in your careers and earn CEs.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.